Authenticity and Interprofessional Learning. Today our webcast is from the Faculty of Health and Social Work and the Centre for Excellence in Professional Placement Learning. Hello and welcome. My name is Ruth Clemow and this is my colleague Melanie Parker. Off camera we have Ray Jones, who will be collecting and collating your emails for us today. During this session we're going to suggest that by underpinning interprofessional learning with theory of authenticity, we can start to move towards patient-centred care. At this point I just want to check that you can hear me okay. All emails today should be sent to ray.jones@plymouth.ac.uk. One of the things that we need to do is to know who's watching today, and we welcome you and we would like to engage with you through the chat room today. Please will you send us an email to ray.jones@plymouth.ac.uk. The heading "Sign in" and tell us who you are. You will then receive an automatic reply telling you which group you're in for later in the programme when we're going to open up our chat room. Can you please do that now? Send us an email to ray.jones@plymouth.ac.uk. I'll restart in 2 minutes. Remember, sign in and say who you are.
Hello, I'm Melanie Parker, and as Ruth suggested, we're hoping to discuss with you how underpinning interprofessional learning with theory drawn from authenticity, we can work towards truly providing people-centred care. We started to think about the application of authenticity in this way because much of our daily work in health and social care requires us to undertake a humanist approach. Authenticity is a cultural construct that has been developing since the time of Plato. Thinking about it in the contemporary sense, we have found it most useful to link it with postmodernism. Although postmodernity tends to be associated with mass consumerism and the McDonaldisation of our culture, it does provide a pluralistic approach to individualism and an appropriate context to hear the multiple voices and perspectives of our interprofessional working environment. Additionally, in the postmodern context, authenticity is widely accepted to have both a social as well as an individual role. With that in mind, we think the following components go some way to capturing the essence of authenticity in post-modernity. And we think that they're about finding our true selves underneath our different identities. Where, for example, we're quite interested in how you identified yourself today when you logged in with Ray. We're also quite interested in authenticity as a moral principle or an idea that must offer some view on how the individual should live with others. So how do we operate within our communities of practice?
In the context of interprofessional learning, I need to know who I am as an individual, as a human being, as a professional, and as an interprofessional in relation to patient-centred care within a team. We define interprofessional learning here as where a number of individuals or groups from a range of disciplines, professions, agencies, and or patients, service users and carers learn with, from and about each other in order to provide effective health and social care. What is significant is that in contemporary health and social care policy, what we see is that the patient now has become the expert, as is the service user and carers. And it's on that basis that we actually feel that the voice of the patient, the service user, the public need to be heard in the development of professionals in their roles. The questions that authenticity asks of interprofessional learning relate to three themes, and we believe they are related to education and the curriculum, health and social care practice in this context, individualism and society. And we're going to look at these three in turn. Mel, can I ask you, in the broadest sense, how authenticity relates to current education agenda?
Well, Ruth, firstly, my concern is that education is being increasingly driven by an economic agenda. The Leach report, published just a few days ago, quite clearly relates education to performativity, and the benefit to society is also being considered in this economic way. True, our economy requires a skilled workforce, but we know from past experience that the gap between the poorest and the richest in this country is increasing. So is it right, do you think, that education is developed in a way that will continue to support this inequality? Surely we're better off entering into a dialogue and finding out from people what they think about education being linked to performativity in this way. So to think about that just a little bit more, what does our education system look like when it's based on performativity? The Leach report said it was going to refer to social justice, but the emphasis remains on economically valuable skills. Gigong, the philosopher, wrote that there must be an education system that ensures people are knowledgeable about the issues that confront their society. So as I said, let's enter into that dialogue with people and find out what they think about linking education to performativity. And Ruth, if I can just turn to you now and thinking of health and social care curriculum, do you think there's any indicators in the current policy of what authentic interprofessional learning could actually look like?
Sure. The government aims, as we all know in the UK, to redesign the NHS, the National Health Service, to develop patient-led and centred care, but also to redesign roles for effective team working and to relocate care near the patient and the public. Interprofessional education, therefore, is a tool in this quest, and the quality and the delivery of interprofessional education as common core curriculum is often, though, perceived as cost-cutting exercise on the basis of economies of scale, which pertain to the appearance of use value. As such, it's intrinsically inadequate and ultimately self-defeating, leading to increasing professional barriers and silos being built. This is a real challenge to us all because we see, and we've seen a proliferation of collaborations that actually enhances and enables this to take place. Therefore, common core curriculum might be characterised and categorised as contrived rather than authentic interprofessional learning. However, interprofessional learning that's located in contemporary policy stems from, for example, the NHS plan and recent documents like Our Health, Our Care, Our Say, Making It Happen, just recently published, provides guidance on better prevention, early intervention to improve health, independence and well-being, more choice and a stronger voice for individuals and communities, tackling inequalities and improving access to services and more support for people with long-term conditions. Essentially, These form a very strong basis for focusing in on authentic interprofessional learning. It's about basing education and training and learning within the context of the care environment. Another document, Options for Excellence, Building the Social Care Workforce, again just recently published, focuses on the team as providing care to sustain the patients or the public with long-term care needs that includes carers, care workers, social workers and occupational therapists. This care therefore is timely and enables teams to work together in the community and keeping the public patients out of hospital except where critically necessary. Another recent publication, the Mental Health Bill, Reviewing the Standards Approach, considers again care service improvement through partnership. We have a huge number of opportunities for locating authentic interprofessional learning in the context of the public and patient at the centre of that care. We've worked for some time now with the National Service Frameworks, for example, and they provide an excellent focus for team approach to care delivery. So if authentic interprofessional education is located for care delivery, we also need to think about learning that is located in practice.
And now let's turn to practice. We'd like you to share your views in the chat room now on this. And please, if at first you don't succeed in logging on to the chat room, please keep trying. What we're going to do is we're going to actually return to the summary of your discussion from the chat room at the end of this webcast. What we'd like you to think of in terms of practice is we'd like you to remember those two key components that Ruth and I have drawn on throughout our thinking of authenticity, and we'd like you to try and think about whether you find you can actually apply those to your practice or whether you've got other sort of definitions and components that you feel is more appropriate. Anyway, over to you now for 6 minutes to share your views in the chat room. hello again, and thanks for your comments. We'll be returning to those a little bit later on.
Mel, whilst we're waiting for everyone's comments on practice, please can you tell me how authenticity links to individualism and society?
Yeah, of course. I think that there is both an individual and social role for authenticity in postmodernity. Broadly speaking, authenticity requires us to respect the values of others as well as ourselves. This is something we're going to try to achieve as part of the work of the Centre of Excellence in Professional Placement Learning. We're developing new and innovative placements with society's more disenfranchised and marginalised groups. The research methodology we are using is an ethnographic approach that's being informed by the work of Freya, who of course emphasise the need for collaboration and dialogue with the people that you're working with. So they very much become part of the research process and part of the process of actually telling us what's important and what we need to include as part of the placement experience. So, okay, just to reflect on that a little bit, what we're saying is actually there's a social role as well as an individual role for society. An authentic person also takes a stand not just on his own life but on the community's project of achieving a good society. So we've got that both individual and that social role, and it's all about improving at the end of the day patient and service user care. So okay, what does that mean for interprofessional learning? Well, what that actually means is person-centred service and care. I'd just like to share with you something that Brendan McCormack said in his 2004 paper, and he was looking at the concept of individualism as from both the patient and the healthcare worker's perspective. He wrote that the relationship between the nurse and patient is paramount, and the values of both nurses and patients are central. The framework that they developed in this working drew on both principles of a life plan of the patient to articulate their individual biography and enabling and disabling aspects of the context of the care environment explored. Values underpin all aspects of the framework, and thus the self of the nurse and patient are explored and articulated in the principles for action. So basically, the experience of the nurse and patient were brought into play in developing the care that was provided for the patient. Also, I would like to see a more authentic rather than media and blame-driven responses to high-profile cases. I'm thinking, of course, of the Victoria Clemow report and the Bristol Royal Infirmary as well report that really set out to actually blame who was at fault, who was at blame. And both of those cases, very interestingly, of course, highlighted the need for us to all work a little bit more interprofessionally.
I spoke earlier about the government drive to redesign the NHS and the roles that provide the care in that context. And so the workforce will look quite different in the future. And that has already become the current, if you like. Authentic interprofessional learning can actually be an enabler of a change in the way that services are delivered. And I think it's important for us to think about how, through the introduction of authentic, people-centred learning, that we can actually see how these new roles might be developed. In a way, then, it's about moving away from the individual and thinking about how the individual, as the professional, works within society or the community of practice. We already see roles like the emergency care practitioner, and before long we're potentially likely to see non-medical anaesthetist. We already have the role of the non-medical prescriber and the nurse prescriber. So there are a number of opportunities, if you like, within contemporary healthcare that can actually provide that authentic opportunity, both moving from the individual through to the community of practice. I think one of the things that's really important here is that meaningful, authentic interprofessional learning it needs to be located, again, and I think I've repeated this on a couple of occasions already, needs to be located with the patient or the person at the centre. there is a risk of valuing freedom of the individual, and that is the individual professional role, above that of the community of practice. And I think we need to guard against this in the deconstruction and construction of professional identity. And one key thing here is that we easily identify ourselves as professionals in our unique professions. However, I wonder how many of us actually identify ourselves as interprofessional. Being able to work effectively, to be able to work across boundaries, but also, most importantly, to be conscious and active in engaging with others to ensure
And actually, if we can just return for a moment to the comments from the online discussion. It's interesting that we've just finished with Ruth's comments on identity, because it seems that identity has been an issue that you yourselves have raised, and we've had comments that in some ways we need to find out who we are before we start treating and trying to learn with others. And also the issue of people-centred care has also come up in relation to identity, and how that's also a useful approach to inform our practice and inform actually the forming of our own identities as well.
I think there's another key thing here. It's about understanding how the student of higher education on a professional programme can actually engage with others to learn and therefore to undertake interprofessional education. And we often focus quite strongly on getting students to learn together, potentially in contrived situations using scenario or role play, but actually it can give them some insight into the ways of practice, the challenges, the issues of practice. But I would also propose that we are supporting students to become more self-directed, to be able to identify their own learning needs within a community of practice, and therefore we can enable them to identify where they can engage with practitioners in the workplace to make their learning really meaningful. So what we have found is that where potentially we are challenged is bringing students and the kind of the right mix of students together, where we have groups that are, cognate groups together. Those are really important. And rather than bringing them together because it's about trying to address economies of scale, we need to also think very carefully about how, therefore, we support students in being able to access practice and the meaning of practice in context of being the interprofessional.
And also thinking about authenticity, how we can sort of put them in touch with their individual selves, which then they can take their own values and experiences and use that to inform their interprofessional practice. Finally, we recognise that the time constraints in this webcast may not have given you enough time to share your views and then enter into the discussion around authenticity with us. Anyway, we'd really like to carry on this discussion with you. And if you've got any general comments about webcasting, please let Ray know, who I believe will be sending you a questionnaire shortly to gain your feedback. But Ruth and I would love to hear from you again around this discussion, so we can hope we can keep it going. Anyway, I'm going to leave you with our contact details, and so say goodbye, and say goodbye on Ruth's behalf as well. Thank you very much for tuning in. Thank you.
Goodbye.
Goodbye.